Hey OT dudes and dudettes, in this video you'll be learning about pseudobulbar affect. It goes by many names: emotional lability, emotional incontinence, involuntary emotional control disorder, and more. Is your patient really depressed or bipolar, or is there another root cause for this? Hi, my name is Jeff, and I am an occupational therapist. I make occupational therapy content for students and new grads on my blog, social media, podcast, and here on YouTube. Be sure to subscribe to this channel so that you do not miss a single video. Let's get functional. Pseudobulbar affect typically affects patients with a neurological condition such as stroke, ALS, Parkinson's, MS, TBI, and dementia. It is often misdiagnosed as another psychological disorder such as depression. How does pseudobulbar affect present? When I worked with patients in occupational therapy, typically the patient's emotional response such as laughing or crying seems out of place. I could be doing an interview for an evaluation and the patient starts to cry when asked a regular question. Or I could be doing ADLs with my patients, such as brushing teeth or grooming, and they start to have uncontrolled episodes of laughing. A similar analogy is if you ever played with a baby, they may sometimes have those laughing episodes and anything you do seems funny to them, or they keep laughing, or the opposite, and they keep crying. It is believed to be caused by a disconnect between the frontal lobe and the cerebellum and brainstem, such as due to a stroke. The most telling symptom of pseudobulbar affect is that it seems out of place and may have frequent episodes of laughing, crying, or anger even. To someone untrained, such as a student, it may seem like the patient is really in distress, such as when they are crying, and it looks really real. Knowing that they may have pseudobulbar affect will not alarm you and better prepare you to handle the situation. The doctors and specialists on my team and where I work were pretty good about bringing it up in the meetings when they believed that the patient had pseudobulbar affect. Although OTs do not diagnose conditions, once you experience it with a patient, you get pretty good at suspecting it compared to other conditions such as depression. What can be done to treat this condition? There are ongoing trials and research with medications to treat pseudobulbar affect. Occupational therapy can also play an important role in helping patients manage pseudobulbar affect with their occupations. Think about how stressful or difficult it may be to have uncontrolled emotions that present, like with laughter or crying, and you may not be able to stop it. It may be very embarrassing, especially in public, and it can lead to social isolation and occupational deprivation. It is important to educate both the patient and the family and caregivers about the conditions so that they are definitely aware of it. Also, the patient can have ways to cope with this condition when they believe they are about to have an episode, with things like distraction of thoughts, therapeutic breathing, changing their position, and relaxation. Overall, occupational therapists can help patients who have pseudobulbar affect function in their daily tasks and other occupations using a holistic approach that is tailored to the patient and their caregivers and the environment that they are in.